Welcome back to Mayo Clinic Radio. I'm Ian Roth.
And I'm Tracy McRae.
Spondylolisthesis is a forward slip of one vertebrae over another. The term comes from the Greek language. Spondylo means vertebra, and listhesis means to slip. Spondylolisthesis occurs most often in the lumbar spine or the lower part of the back.
Let's see how many times we can say that word in this setup here. There are many causes for spondylolisthesis. A vertebrae might be defective from the time a person is born, or it could be broken by trauma or a stress fracture. Commonly, the disorder occurs in children and adolescents who are active in athletics, such as gymnastics. Here to discuss is Mayo Clinic orthopedic surgeon Dr. Brett Freedman. Welcome back to the program, Dr. Freedman. How common is spondylolisthesis?
Well, first, thanks for having me back.
Yes.
It's always fun to be here. You mentioned there's two primary basic types. One is a sort of a defective type of spine, one in which there's a small crack that develops early on in life in the back of the spine, typically at the lowest lumbar level, which is L5. And when that part, which is called the pars, breaks, that releases the spine and allows it to slip forward. And so that particular version of spondylolisthesis is present in about 5 to 6% of Americans. There's some genetic predisposition, and so there's certain groups of people, specifically certain types of Eskimos, in which that rate jumps up to 22%. And then the other type is degenerative spondylolisthesis, and that occurs because of the way in which the spine ages. The spine has 24 vertebrae, and between each vertebra is a disc, which is that shock absorber. Mm-hmm. As that shock absorber ages, it tends to lose its height. And all the ligaments that support the spine are tensioned at the right height. And so as you lose the height, there's some people that become a little bit sloppy with their motion, and it can develop this slip. So we see those in older people. And over the age of 60, the rate of spondylolisthesis can be as high as 30%.
So is the congenital kind the kind that you're born with, or the kind that you develop? What is more common?
Much more common to develop later in life,
okay.
But also more common for that to be just the way your spine ages. If we get an MRI of anyone over the age of 60, I'm going to find something I could operate on, but we're not going to do that unless there's a symptom and a problem to match to it. And so for many people, spondylolisthesis, whether it's the lytic type, which is the type that happens young, or the degenerative type, which happens older in life, these are incidental findings caught because my stomach hurts and I get an x-ray of my abdomen. The vast majority of us will live with our spondylolisthesis and either have no idea it's there or have no reason to see a spine surgeon. But when the cat's out of the bag, and this becomes a symptomatic and a episodically symptomatic problem, that's when we start to think about doing what we do.
But a lot of people complain about back pain all the time, especially lower back pain. Is this something that people should go and get checked out? Do I have spondylolisthesis?
So back pain is really something that all humans get at some point in their life. And so we really need to wrap our heads around that. It's sort of one of the costs of being a human being and walking upright is that we will have back pain. Some of us will have more than others, and some of us have some body traits that increase that, some genetic traits that increase that. But there are, when you have such a common problem as back pain, something that's second only to the common cold in terms of primary care visits, you wind up with a lot of people have a similar problem, and so we can come up with a sort of defined way in which we work up back pain. And that workup includes x-rays after 4 to 6 weeks of sustained symptoms. And so most spondylolisthesis would be detected at that point in time. Certainly any significant spondylolisthesis would be detected. So it's not something that you need to look for independently. It's something that's sort of part and built into the process. But it is one of the treatable causes of back pain.
Back pain is kind of a catch-all. You could have some nerve or muscle, or you can barely move, whatever. What kind of back pain are we talking about?
So typically it's a mechanical back pain, but again, back pain is non-specific, right. And even mechanical pain can be non-specific. So what's mechanical pain? That's pain that's worse with activity, better with rest. And one of the treatments for back pain related to degenerative changes of the spine or problems in the spine is that we fuse the spine, and so essentially we put it at permanent rest. And so if you're someone that has pain continuously, that's a very different person than someone that has a pure mechanical pain, which is I feel wonderful at rest and I feel awful with motion and activity. And towards the end of the day, it gets worse. So that piece of information, that the quality of the pain is important. But mechanical quality back pain is something that is quite common in spondylolisthesis, and probably one of the reasons why addressing it when all else has failed, and it's certainly the last step to do surgery, is a meaningful intervention for about 3/4 of people.
Yeah, I was going to say fusion surgery does not sound like someplace you want to go, so I'm glad it's the last resort. But what do you do before surgery then? What are other options for treatment?
And so, and I think that's an important piece of the puzzle, is understanding that spondylolisthesis doesn't separate you from the rest of humanity. So we treat it like we treat back pain. And so we talk about a spine healthy lifestyle, which includes optimizing your body weight, optimizing body mechanics, including cardiovascular exercise, weight-bearing exercise, ensuring that you're not too sedentary. And so doing things that take care of yourself. That's where it all starts. And then when that's not successful and activity modification isn't successful, then we go up our ladder of treatment. Next up on the rung would be our physical therapies. Next up would be medications, or you can reverse the order of those rungs. And then the fourth step on the ladder would be an injection. And so there are specific types of injections, specifically PARS injections, which are injections to that little crack in the 5 to 6% that have the lytic type of spondylolisthesis, that can be very telling. Oftentimes they're not therapeutic, which is to say they're not curative of the problem, but they at least tell us this is what pain is stemming from this location, and they can give us some confidence in moving forward towards the fifth step on the ladder, which is surgery.
You kind of touched on it a little bit there, but are there other things that people can do to avoid these kinds of problems?
So certainly. So back pain is a product of genetics plus exposures. And in some people, it's purely the exposure, so it's the life you've chosen or a trauma that's occurred to you. In other people, it's purely the genetics. And no matter how pristine your life, you're still going to have a problem. And so some mixture is inbred in each and every one of us. And so all we can modify is the exposures piece. So we can modify what we look like, what we do, and how we behave. And we can also modify how we feel about ourselves, because there's certainly a strong psychosocial aspect of all back pain as well.
That phrase that you used, spine healthy lifestyle, is something that I don't know if a guest has ever used that phrase, but it makes a ton of sense when it comes to a lot of the different back issues that we talk about on this program. What exactly does a spine healthy lifestyle mean to you?
Sure, that's great. So it is my catch-all phrase, and I think every single patient that sees me is at risk of getting my little handout on that subject. And so that includes the ideas of obtaining an ideal body weight. It includes the ideas of engaging in cardiovascular exercise on a regular basis, 3 to 4 times per week. It includes the ideas of moderation of alcohol intake, not smoking, both of which decrease your chances of negative outcomes with your spine, specifically bone softening and also pain. And disc degeneration in terms of smoking. It includes setting up an ergonomic work environment, so the things are in good reach and that you sit with your feet on the ground, and also maintaining good flexibility. We all should be able to touch somewhere close to our ankles when we're standing up as we bend forward. And then it includes overall, just trying to make sure that we have a healthy outlook on life too, because pain begets a pain, and there is a strong piece of this back problem that's called biopsychosocial. It's unlike many things. When I break a bone, that's pretty much a physiological and anatomic phenomena. But when I have back pain, that is a holistic thing, and so we need to make sure we touch on all 3 aspects.
We've been talking about treatment for spondylolisthesis. I'll work on it some more.
I hear you. I try it on my YouTube.
With Mayo Clinic orthopedic surgeon Dr. Brett Freedman, and the importance of a spine healthy lifestyle. Thank you so much, Dr. Freedman.
Thank you.